When patients and caregivers first receive an Alzheimer's diagnosis, they don't always know what it means for them moving forward. While every patient's experience varies, the 7 stages of Alzheimer's framework helps people living with Alzheimer's understand the clinical progression and plan for the future. The framework is based on the Global Deterioration Scale for Dementia, which was first published in 1982 by neurologist Barry Reesberg and his colleagues. Stage 1: No symptoms. There are no clinical signs of memory loss or impairment. Biomarkers of Alzheimer's, like beta amyloid plaques, start to build up in the brain 10 or more years before the onset of the disease. As it's impossible to predict whether someone will develop Alzheimer's based on these biomarkers alone, testing asymptomatic people is not recommended unless there's a family history of rare genetic forms of Alzheimer's. Stage 2: Age-related memory loss. People may notice problems with memory and cognitive abilities. They may have more difficulty remembering names or events from several years ago, and where they place things like keys or remote controls. It's hard to tell whether this decline can be attributed to early signs of dementia or normal aging.
I left a sweater at a concert. I swam in a lake and left my wet bathing suit behind a tree. And on an international flight, the flight attendant held up a passport and said someone dropped their passport in the aisle, and I didn't have to look to know it was going to be mine. So those were some of the early signs.
What can you do as a patient? Speak with your doctor. They may perform a physical exam, discuss family history, or run tests to rule out other conditions that might be causing the symptoms. Stage 3: Mild cognitive impairment. Common symptoms include forgetting the names of new acquaintances, losing items more frequently, and having trouble finding the right words. Some people with MCI may also develop anxiety, have trouble concentrating, and withdraw socially. Family and friends may notice these symptoms. What can you do as a patient? Make lifestyle changes and participate in activities that stimulate your brain. Visit a doctor who can run a neuropsychological test to evaluate your memory. Stage 4: Mild dementia. Patients develop more problems with short-term memory and may become more emotionally withdrawn. They may forget significant events, holidays, or visits with relatives. They may have trouble doing simple math, remembering to pay their bills, and become vulnerable to financial scams. On average, this stage lasts 2 years.
I was forgetting appointments with counselors. I was forgetting to look at my notes and my appointments too. And also, I wasn't as organized as I used to be. And I can recall a time where there was a lot of input I had to put into the computer, and it was typical. And I had no problems before. And then all of a sudden, I can remember I had difficulty inputting the data into my laptop.
What can you do as a patient? Talk to your doctor about the risk and benefits of Leqembi and drugs like cholinesterase inhibitors that can manage some symptoms. You can also plan for the future by speaking with your family about how you want to be cared for as the disease progresses, and look into long-term care and estate and legal planning. Stage 5: Moderate dementia. People will have trouble recalling details like phone numbers and navigating inside or outside the home. They may require daily assistance for dressing or feeding themselves. Patients who do not receive adequate support might start to develop behavioral problems like anger and become overly suspicious. On average, this stage lasts 1.5 years. What can you do as a patient? Make a plan with your caregiver to participate in social groups and activities. Take up creative hobbies like painting, dance, or music. Stage 6: Moderately severe dementia. Patients have more trouble with memory, difficulty recognizing faces, experience personality changes, and require daily living assistance. They may lose control over their bladders and bowels and may wander off. On average, this stage lasts 2.5 years. What can you do as a patient? You may have trouble communicating your wants and needs. Consider whether you want to be placed in a specific elder care facility. Consider setting up instructions and signing power of attorney over to a family member or loved one to ensure your wishes are met. Stage 7: Severe dementia. Patients need assistance with all aspects of life, including feeding, going to the toilet, and bathing. Body movements can become more rigid. Some people will lose the ability to swallow. What can you do as a patient? Write a living will ahead of time for doctors and nursing staff. The living will lays out preferences for the treatment or care you want. Being Patient talked to dementia and palliative care Dr. Liz Sampson, who said caregivers should ask their doctors how to best keep their loved one comfortable and maximize quality of life.
It's about focusing on the person and their needs, if they've had any previously expressed wishes, and really focusing on maintaining their comfort and the quality of the life that they have left. You can get very hung up thinking about medical things, but actually at a very basic level, even with someone with advanced dementia, they are aware of the atmosphere around them. It's just comforting to be surrounded by nice smells, by music they like. All of those things reach the more inner parts of our brain, which trigger more basic emotional responses in us. So there's good reason to think that taking all of those approaches, the sound of a familiar voice, holding someone's hand, is going to register with them on some level.